Okay, so this is the last part for the module 1 of healthcare innovation and entrepreneurship. We have already covered all these 4 points, that is the overview of healthcare industry landscape, both in the Indian structure as well as in the global structure. We have also seen the need for the innovation and the role of entrepreneurship. We have seen the case studies of successful startups in India as well as in international scale. Today we will be covering the concept about this design thinking and also the ethical considerations in the healthcare entrepreneurship. I am just sliding over the slides to go for a quick revision. This is the global healthcare landscape. This is the Indian healthcare landscape, the whole overview. Then we have come across the need for innovation in healthcare. Next, the role of entrepreneurship in healthcare. Lastly, in the last class, we have seen the case studies both in India and international scale. Today, we will be starting the design thinking in healthcare. So, design thinking is a human centered solution oriented approach used to solve complex problems creatively. In healthcare, it helps professionals and innovators develop effective, empathetic, and sustainable solutions by deeply understanding patient and provider needs. So, what is design thinking? Design thinking is a 5-stage interactive process used by designers to approach problems creatively. Number one is empathize. Under empathize, we can say it understands the user's needs, emotions, and challenges. Next step is design. It clearly states the problems based on the insights collected. Number three is ideate, brainstorming multiple creative solutions. Fourth is prototyping, that is developing quick and inexpensive models depending on the situation. And lastly, the tests, which refines and again creates the ideas through user feedbacks by understanding all the challenges and the bottlenecks. It mostly promotes empathy, collaboration, and also experimentation. Next is importance of design thinking in healthcare. First is patient-centric solution. It encourages deep empathy within the patients. Next is improves processes. It reduces inefficiencies and enhances patient experiences. Third is drives innovation. It generates creative solutions to chronic issues. Fourth is cost effectiveness. It minimizes expensive mistakes by testing ideas very early. Fifth is bridges gap. It connects clinicians, technologists, and administrators. Under application in healthcare, that is the application of design thinking in healthcare, we are getting the first point, that is improving patient experience, which in the presentation is written patient experience. Hospitals use design thinking to redesign patient journeys from admission to discharge and to reduce waiting time, which ultimately improving patient satisfaction. Number two is medical device design. Empathy driven insights help design user friendly devices like portable ECGs, insulin pens, and prosthetics. Number three is digital health solutions. Applications and telemedicine platforms use design thinking to ensure that they are intuitive, inclusive, and accessible to patients of all ages. Number four is clinical workflows. Hospitals apply design thinking to streamline nurse shifts, surgery schedules, and patient flow, increasing safety and efficiency. Next, we will be seeing few case studies of design thinking in healthcare. The number one is Stanford Medicine X program. The problem over here was poor communication between patients and doctors, and the approach that was been done is using empathy interventions and patient shadowing, and the outcome that we got was developed better consultation formats, visuals, and decision aids. Number two is GE Healthcare, that is MRI redesigning for the children. Children were scared of MRI machines. If we have gone through the MRIs, or any of our family members have gone through MRIs, we have seen that MRI machines are very huge and it may be claustrophobic in some cases, and for children there is a huge chance of being that. So the solution that was induced was using design thinking to create adventure themed MRI rooms like pirate ships, like Jungle Books, and the impact that was reduced was reduced sedation rates and improved scan success. Number three is under case study in India, we can see is Narayana Health. The problem detected was affordable access to cardiac surgery. The approach that was been made is redefined hospital processes and rules using design thinking. The result that we got is achieved world-class care at low cost using an assembly line approach to surgery. Next, we will be coming across the challenges in implementing design thinking in healthcare. The number one is resistance to change. Traditional systems may resist new approaches. Number two is limited training. Few healthcare workers are trained in design thinking. Number three is time constraints. Busy schedules leave little time for innovations. Number four is stakeholders misalignments, conflicting goals among patients, providers, and administrators. The last point that we will be covering under design thinking in healthcare will be the strategies that has to be promoted for design thinking. Number one is workshops and boot camps, that is training staffs to adopt human-centered methods. Number two is multidisciplinary teams, including doctors, designers, patients, and engineers. Number third is leadership support, encouragement from hospital administration. Fourth is pilot projects, starting small to prove value before scaling. Moving on to the next slide, that is we will be getting these ethical considerations. Okay, ethical considerations, what is that? Ethics in healthcare entrepreneurship involves applying moral principles to decisions about products, services, and business operations. Since healthcare deals directly with human life and well-being, entrepreneurs must balance innovation and profit with ethical responsibilities. Ethical concerns span areas like patient data, affordability, advertising, safety, and equitable access. Next is importance of ethics in healthcare innovation. Number one is trust building. Patients and stakeholders must trust that healthcare solutions are safe and reliable. Number two is protecting patients. Ethical practices protect patients from harm, misuse of data, or exploitation. Number three is regulatory compliance. Following ethical norms helps avoid legal issues and regulatory penalties. Number fourth is sustainable growth. It ethically grounds up the startups and help earning long-term credibility and investor confidence. The key principles in healthcare are autonomy, that is respecting patients' rights to make informed decisions. Number two is beneficence, acting in the best interest of the patient or the community. Non-malfeasance, avoiding harm through negligence or poorly tested products. Number four is justice, ensuring fair access and equity in care delivery. Number fifth is confidentiality, that is safeguarding patient data and privacy. The next topic that we will discuss regarding the ethical considerations are common ethical challenges faced by the healthcare startups. The number one challenge is data privacy and security, that is digital health applications collect sensitive data which can be a risk. Number two is clinical trials. New drugs or devices must be tested ethically, then it should be applied. Number three is access and affordability. Innovations may be priced beyond the reach of common people, so the price has to be controlled as soon as possible. Number fourth is advertising and claims. Exaggerated marketing can mislead consumers sometimes. Number fifth is conflicts of interest. Many startups may prioritize profits over patient welfare. The fifth topic that we will be discussing here is regulatory and legal framework supporting ethics. Medical Council of India, that is MCI guidelines, has been provided for professional conduct of medical practitioners. Also, ethical guidelines by Indian Council of Medical Research, that is ICMR, for biomedical and health research involving humans. Number three is Drugs and Cosmetics Acts in India, which regulates the approval and sale of drugs and devices. Number fourth is data protection and regulations. India's DPDP Act, that is Digital Personal Data Protection, and international standards like GDPR has been introduced. Some real life examples of ethical dilemmas can be said as: number one is Theranos, that is in USA. It claimed to perform multiple tests with a single drop of blood, withheld scientific evidence, misleading patients and investors, and the outcome is shut down criminal convictions and loss of public public trust. So we can see that the ethical part should always be remembered while considering this a real life example. Okay, the next example that can be quoted is patents versus public health. Now, expensive patented HIV drugs unavailable to poor patients. The solution is India allowed compulsory licensing for generic versions, ensuring access over profit. So when we are talking about health, when we are thinking about giving people the health services, sometimes we have to lose on the thinking of profit and jump into and indulge ourselves into the um, pure serving to the patients, to the people. The third real life example that can be quoted is artificial intelligence bias in healthcare applications. Some algorithms trained on non-repetitive data sets gave inaccurate results for minority groups, and the ethical solution that was concluded was inclusive data collection and regular audits. So from all these points, all the 6 points that we have covered till now, the strategies for promoting ethics in healthcare entrepreneurship can be said as: first one is ethics committee, which establishes ethical boards to review decisions and practices. Next is very clear transparency. The company should be open about pricing, product limitations, and the potential risks, and whatever services they are providing, the companies should be clear and transparent about that. The third one is training. Regular workshops for teams on the healthcare ethics and compliances should be conducted. Fourth is stakeholder engagement. It includes patient voices, community leaders, and clinicians in decision making. With that, we are completing the module 1 of our subjects, that is healthcare innovation and entrepreneurship. In the next presentation, we will be continuing with our module 2. Thank you.